Hi, this is Dr. Peter again, and today we'll answer some of your questions, the frequently asked questions regarding matters breast, be it a breast reduction and a breast lift. So here we go. A few questions came in from one of our clients, and I'd be happy to answer them even in this forum. So they are not in any particular order, so we'll go straight into it. How long does it take for a breast to heal following a reduction or even a lift? Now, usually my standard answer is that all wounds heal in 5 to 7 days and are sticky or thereabouts, and by around the 10th day you have fair wound strength and the healing continues. So as you go into the second, third week, more or less things are fairly stable. Of course, there are factors that may slow down wound healing. For example, if someone is a smoker, usually you advise that you stop smoking at least 2 to 3 weeks prior to the surgery, or even longer if possible, or not at all. If you can avoid smoking, you tend to get better results. The other bit is that if you're big, if your body mass index is high, generally wounds will heal slower. So the bigger you are, the slower the healing. Things like diabetes, or if say someone has diseases like kidney issues, those tend to slow down wound healing. And of course, the rare group are people who have connective tissue diseases, and that also slows down healing. So another question that we are frequently asked is, how long will you be in hospital following, say, a breast surgery? Now, great breast surgery done well, usually you come in the morning, you have your surgery, and in the evening you can be at dinner with your friends. It's that straightforward. That said, we all behave differently, and there are people just, traditionally in our African setting, when someone has surgery, they want to be treated as very sick, and there are people who want to be in bed and not move or go anywhere at all for the entire duration of their recovery. So some people would want to be, say, in hospital for 5 days. But really, for breast surgery, you can have your surgery and go home the same day. We call this day surgery. Risks of the surgery. So when you have breast surgery, any breast surgery, we are worried about, say the nipple sensation. And depending on who does your surgery or how it's done, the nipple sensation should be preserved. So that's one. The second one is, of course, wound healing. And some people, as alluded to, may be slower than others. Yeah, by the end of the day, wounds do heal. But principles of surgery have to be respected. The other risk, of course, things like a small bleed within the breast. And when we are operating, we operate meticulously so that you do not get those issues, but sometimes they do happen. Now, the biggest risk, of course, is that you will look very good. So this is an interesting one. How many successful surgeries have I done? Many, very many. So the mark of a good cosmetic surgeon is one who is comfortable even performing reconstructive surgeries. I speak for myself when I say that I think I have a fairly vast experience doing these surgeries. Yeah, so I think that answers it. So many. That's the answer. Very many. Yeah. To recap, part of the training was that we had to do several surgeries. And then I did some work with the Gigantomastia Foundation at the time. And we traversed Kenya doing lots of breast surgeries and all through. So I've done lots of breast surgeries, lots of cosmetic surgeries. And along the way we coined the term Paki Daily. So at Ace Plastic Surgery we're making those breasts Paki Daily, and proportion is a hallmark, and of course it's a good thing. It is a good thing. Daily. Yeah. So one of the questions asked is, this particular patient was asking, do I need a reduction or a lift? So about several patients will come in and they will not be sure whether it's just a lift they need or a reduction. But generally, when a breast is heavy, when a breast is larger than your frame, and at least 800 grams or more, then it becomes a reduction. And a lift, if it is sagging, or a combination of a reduction and a lift, if you want to achieve great aesthetics, cosmetic changes. So sometimes we have to combine both. Yeah, and the lifts can be simple, where it could be, say, skin only, and we're just using the skin to give you a new shape. And so to speak, we're using the skin as a bra. And then as we rearrange the tissues, we get a lift, you get a mold, so that the breast is nice and packy. Yeah. So and people's tastes vary. Some people want them large, some people want them small, some people want them, well, at least they agree on one thing. A perfectly shaped breast is more or less pear-shaped and pointy. In Kenya, the term is sasita kila wakati. So it's generally that. People want shapely breasts, proportional to them, that look good. Yeah. And usually you don't want to tie your surgeon to a particular size, but rather you give them the freedom to design and literally shape your breast, mold it to your proportion. That proportion for me is a mark of a good breast reduction or a breast lift proportion. So price. So part of the consultation when you come in is a discussion on the costing of your surgery. Now, there are several rules in life when you talk cost. The cost and the price are rarely the same thing. But the things that go into costing include, for example, the surgeon's experience, the facility where you're having your surgery, the duration of the surgery, the materials used on you for the surgery. And generally, we all want a good surgical outcome. You want the best technique used on you. So what I advise my patients is that, yes, there is a cost to it, and there is a price, and it's easy to shop. You know, you make 10 calls and someone gives you a price, but really, what are they doing for you? So when we are discussing price, we prefer to have a one-on-one discussion with someone so that we can tell you the cost. And a consultation is a great experience for you and for the surgeon to have a feel of what you need, and invariably you will get told the cost. Yeah, so I feel it's actually unethical for someone to pick up the phone and tell you this is going to cost you this before they even meet you. Yeah, because I guarantee you there is more. It's like it's like really a meal, so to speak. When you have a consultation, you might have starters, you might have the main course, and you might have toppings if you're discussing another type of meal. But really, at the end of the day, a consultation is an invaluable experience, and we answer questions as the ones we are asking, and you get to ask about the cost therein. And that also doesn't take away from the surgeon, because it's not, unfortunately, it's not a piece of something that we're haggling over, and it shouldn't come across as that. And most of your surgeons and your doctors will be good people, and to be honest, it's a bit impersonal if you're asking about the cost without meeting your surgeon, because people are different. People's physiologies are different. So there's no, I tend to, and this is my personal opinion, I tend to hold the opinion that no two people are exactly the same. And especially when it comes to costing, it should be tailor-made for the individual. Yeah, but there are guidelines. I'd be happy to discuss with you those when you come in. Thank you. So nipple sensitivity after surgery matters breast. More often than not, if you have, say, a breast implant, your sensation should be intact. There are reports of heightened sensitivity. And following a breast reduction or a lift, your nipple sensation should be intact. Now, there are people in whom it becomes dicey to save the nipple sensation, and these are people with extremely large breasts. But even so, every attempt is made to preserve your nipple sensation. And if you meet me, I'll tell you about my percentages. But suffice to say that nipple sensation should be intact following a breast reduction and a lift. For your comfort, usually we will use general anesthesia. And the reason we use general anesthesia is so that we can manipulate the tissues, we can place the implants right, we can mold your breast tissue right, without you uncomfortable. And because also of the duration of the surgery, 2 to 3 hours sometimes to get it right, and you want the patient as comfortable as possible. And the side effects of anesthesia would be, for example, you would feel drowsy immediately after the surgery, and that's okay, it wears off. You may feel a bit nauseous, you may feel like throwing up. So we reintroduce the feeds gradually after the surgery. And some people do complain of headaches, especially, speaking generally, say if they have had spinal anesthesia, and sometimes things as simple as coffee and tea do resolve some of those headaches, for example. But generally, a good blend of your pain medication ensures that you're pain-free. A good number of our patients are pain-free 100% for 2, even 3 days following some of the cosmetic surgeries we perform. So pain can be an issue following surgery, but a good amount of the time it's not. Of course, the other risks like wound infection, it's rare, especially if you have a clean theater dedicated to cosmetic surgery and clean procedures. Yeah, so the other risks of surgery, of course, include things like bleeds, and we call them hematomas. Again, technique and also following instructions after surgery. Rarely do we get patients' wounds opening up, but when we ask, we are told they are, in any household there are small babies and there are big babies. Sometimes the big babies disrupt the work we've done, and that done too early can be a reason why, say, someone has a bleed or the wounds open up. And I've had a number of patients, if you ask, they tell you they did something and a wound opened up, there was a bleed. Yeah, but more often than not, complications are rare. Next question in our series of frequently asked questions is, will a breast lift reduce size? Now, usually with a breast lift, as mentioned, or you could use just skin to achieve the lift. and manipulate the tissues a bit. Sometimes we don't dissect as much. So if it is a breast lift, sometimes we do, and we have to take out a portion of the breast so that we mold it to have the right proportion and shape. And yes, there may be very little breast tissue taken out, even at a breast lift. And yes, for sure, in a breast reduction, there's always some tissue taken out. And sometimes we combine liposuction with some tissue excision to achieve the lift or the reduction. What if I gain weight is another question. If you happen to gain weight, chances are even the breast will gain weight. But here's the rider, it can never be as it were. A fallen breast, fallen soldier, as commonly referred to, when the breast is ptotic, facing down, for example, and you raise it, even when you gain weight, you gain it in the new shape. But of course, a breast doesn't have bone, doesn't have a skeleton, and tends to go changes that are age related. And over time, even a breast that has been raised may start folding again, but takes time. But for some people, it falls faster than others. And again, it goes back to what the inherent issue was with the breast. And so for that unique category, for those, we may need to put a breast implant in as well, so that we retain the shape. Breast symmetry. Now, breast symmetry is important because it's immediately obvious if one breast is larger than the other. But it can happen, especially if you have a very huge breast. For some people actually born with one breast that is larger than the other. And again, no two breasts are exactly the same. Usually one may be lower, one may be larger. But the aim at cosmetic surgery is to make them as proportional as possible and as symmetrical as possible. So, how soon is surgery performed? Usually after a good consultation, tests should be done. Due diligence, as we call it, should be done. Your blood works should be done. You should have a good hemoglobin count, for example, because the hemoglobin carries the oxygen for circulation, for healing of the tissues that will be operated on. Usually we would check to make sure that, say, your kidneys are functioning fine, because most of the medicines are excreted through the kidneys. The other bit that may be done, sometimes scans may have to be done to be sure that there is no underlying pathology. And maybe to add in the aspect of males, if a man has man boobs, we may have to also do hormone assays, hormone levels, checks to be sure that the hormones are within a certain norm, because that in itself can be a reason as to why a patient has a very large breast, man breasts in men, for example, or very large breast in a female again. If it's come back again, for sure, one would have to check to see if the hormones are an issue. And that becomes one of the tests that one does to be sure that, for example, it's not an inherent problem. So the answer to that is that surgery is done when one is sure that the patient is stable and the patient has done the requisite tests before we operate. What are some of the things that we'll do for you? We encourage patients to wear post-surgical bras after surgery, and it helps if they can have more than one, so as to be able to change. And then also medication, analgesics, that is painkillers, and antibiotics will be prescribed as part of your regimen following your surgery. Okay, so it's been good discussing some of the frequently asked questions Martha's breasts. You want those breasts sparky, you need to know who can do it for you, how well they can do it for you, and ask the relevant questions. Please do your homework so that at least when we meet, we have some of these questions to answer, and we'll be more than happy to meet you so that we can discuss this. And God bless you.